objective, after listening to this module, you'll be able to describe the role that stress plays in heart disease. Stress and heart disease. Which muscle is the strongest muscle in your body, and probably the most important? Your quadriceps are muscles in the front part of your legs, your hamstrings are muscles in the back of your legs, your biceps or front of the arms, your triceps or back of the arms, your abdominal muscles, or your heart. Your heart is the strongest muscle in your body and is the most important muscle to protect and keep in shape. Unfortunately, stress definitely affects the heart. You know that stress affects the cardiovascular system, so it's no surprise that heart disease is very strongly correlated with stress. Before you say heart disease doesn't affect me, I'm too young to have heart disease, I need to tell you that in the United States, the beginning stages of heart disease has been shown to occur in children as young as 5 years old. Of all disease and illness, heart disease is the #1 killer by far in terms of premature deaths among adults in the United States. It is true that we have an obesity epidemic in our country right now, and yes, obesity is a major cause of heart disease, but there are quite a few people who are far from overweight who are having heart attacks and other health-related problems. Stress, or the inability to effectively manage it, is now being considered a major contributor to heart attacks. Cholesterol. Stress is associated with heart disease because when stress hormones, adrenaline, noradrenaline, and cortisol, are secreted, extra fat is released into your bloodstream and then returns to the liver where it's converted into cholesterol. Elevated cholesterol, specifically LDL cholesterol, is strongly correlated with heart disease. College students have been shown to have higher cholesterol levels during final exams than before or after the exams. Accountants have higher cholesterol levels during tax time. Dr. Paul Rose, professor of medicine at the New York Medical College, found that stress can be more powerful than diet in terms of influencing cholesterol levels. Several studies, including one of medical students around exam time and another of accountants during tax season, show significant increases in cholesterol levels during their stressful events when there was little change in diet. The usual treatment plan for patients with heart disease is to lower cholesterol and blood pressure, encourage patients to stop smoking, engage in exercise, have patients take heart medication, and sometimes undergo angioplasty or bypass surgery. But many cardiologists are now advocating stress management to their patients with heart disease, along with their prescribed list of treatments. Check out these results. In patients who had a heart attack, relaxing, taming hostility, and changing the way they look at life's challenges reduce the risk of having further heart problems by 75% compared to people given only the traditional medical care and medications. If a new drug produced the same 75% reduction in cardiac risk as stress management, it would make the headlines on the front page of every newspaper everywhere, and physicians would prescribe it to all of their cardiac patients. Dr. Alan Young, a cardiologist at Harvard Medical School, found that those already suffering from coronary heart disease experienced even more constriction of blood vessels when under stress. On average, the most clogged arteries constricted an additional 24% when patients were experiencing stress, while the healthy vessels in the same subject remained unchanged. Healthy vessels were able to handle the stress, but the damaged ones lost their capacity to adapt. Dr. Deborah Mosey of Ohio State University gave a stress test to patients less than 40 hours after having suffered a heart attack. Patients with high anxiety scores were 4.9 times more likely to suffer additional complications than patients with lower anxiety scores. Stroke. Stroke is associated with stress as well. Dr. Lauren Brass, a physician at Yale Medical School, found that severe stress is one of the most potent factors for stroke, more so than high blood pressure, even 50 years after initial trauma. In a study of 556 veterans of World War II, the rate of stroke among those who had been prisoners of war were 8 times higher than those not captured. Key points. Stress can be very dangerous because it's associated with perhaps the most dangerous type of disease, and that's heart disease. And that's it.